Hi, I'm Jerry Halverson, and I'm asking for one of your votes for the Council on Medical Service. It's hard to believe what's happening in medicine these days. Physicians work to save lives while medical practices of all sizes struggle. Doctors take pay cuts while continuing to risk their lives with inadequate PPE. It's crucial that our AMA, with strong input from the Council, shapes medicine in the post-COVID world and helps give our practices needed relief. I have the experience to help at this crucial moment. I am a clinician, an administrator, and a leader in medicine. I am Chief Medical Officer of a large national not-for-profit behavioral health system, and I've done this work. I've been president and now board chair of my county medical society, chair of the Section Council on Psychiatry, and chair of SSS. I am asking for your vote because I have the experience needed to help the council do its important work in these unprecedented times. I'm Jerry Halverson. Thank you.
Regarding physician practice viability, what suggestions would you offer to physicians struggling to remain solvent?
That's a very good question. With COVID, physician practices of all sizes are struggling. We're seeing I'm hearing in Wisconsin, small practices not able to open their doors back up, are very concerned, and we have hospital systems that are laying off physicians and giving them pay cuts. I think the first thing that you can do is try to move forward with your practice as quickly and safely as possible. Obviously, we're all physicians, and we need to be able to take care of the patients that need us. This pause in treatment has not only affected our practices, but it's also affected our patients. So I would hope that at this point, whether it's with PPE or whether it's virtually, that you are able to continue with your practice. I would ask you to do what's best for your patients and to do it safely.
What do you see as the current challenges of telehealth now and beyond this pandemic?
Telehealth has been a boon for some practitioners and not necessarily a boon, but a bust for other practitioners. As a psychiatrist, I've been fortunate enough to have telemedicine allow our health system to be able to give the care that our patients need. Now, the problem with that is not all patients want to do telehealth, and it doesn't work for every practice. So telehealth, for those that need it, is very helpful. Obviously, once we're out of COVID, there are going to be some issues with privacy. There are going to be issues with quality. I think we've gotten rid of a lot of our regulations that made it difficult to do. It might be too unregulated at this point. I think we need to make sure that the quality is there, that people that are able to do the work are doing the work, and making sure that all of our patients have access to telemedicine if they need it.
What are your thoughts regarding healthcare reform, specifically comment on single payer and public option?
Whenever I'm asked questions about healthcare reform, I just fall back to our great AMA policy that we have. Single payer, I absolutely understand the desire behind single payer. The desire is to try to get more people covered. But right now, that is really what the AMA thinks that we should do too, and that's our policy. The problem with single payer is single payer on its own violates a lot of the policies that we hold near and dear. We want our patients that like their current health insurance plan to be able to keep their health insurance plan. If there's Medicare for all, that's not necessarily going to happen. We want our physicians to be able to choose what practice, what they take, what insurance companies they take, and what they practice with. So we really want a plurality of choices, and Medicare for all takes that away. And speaking from a psychiatrist's perspective, the parity problem in Medicare is a big problem.